misconception about concussions is that there's nothing you can do to treat a concussion. You just have to rest and wait for it to go away. The first reason that misconception is not true is because we do have really good treatment options. Research has come a long way in the last decade in terms of identifying different profiles or subtypes of concussion. And so we can identify the specific subtype of concussion that a patient is experiencing and match treatment options to exactly the presentation that that person is having after a concussion. The second reason that thought that you just need to rest and your concussion will go away is wrong is because that leads people down the road to what's been called cocoon therapy or dark room therapy. Basically, the person lays in bed in the dark for a week, 2 weeks until they feel better. But as I'm sure many of you watching can imagine, if we were to shove you and told you to lay in bed for a week in the dark until you felt better or until you felt normal, well, when would you ever feel normal? That's not your normal life, and now you're losing outlets and hobbies and activities that make you feel fulfilled and enjoy the life that you're living. It actually tends to make people worse to shut them down like that. So it's really important that we get people matched up to the treatments to fit the type of concussion that they're having, rather than letting people sit in the dark and decondition and become hypersensitized to our normal everyday environments. A second common misconception about concussion is that there's a magic number of concussions after which you're no longer safe to play contact sports, for example. But in fact, again, everyone's presentation after a concussion is highly individualistic, and what one person experiences after a concussion may look entirely different than what another person experiences. So that's why it's so important to seek specialty multidisciplinary care, and with your doctor you can come up with a plan both to recover from this injury and to discuss your risks for continuing to play contact sports or suffer subsequent concussions in the future.